March 31st is the deadline for health insurance enrollment under the Affordable Care Act. But the Obama administration has announced that the open enrollment period is being extended until mid-April for those who are still in the process of signing up. Nationally, more than 6 million people have enrolled. With the deadline nearing, the Oklahoma Primary Care Association and other private groups are helping uninsured people enroll, but many of them are finding out they don't qualify.
Stand up, sing out, let's all spread the word.
In a recording studio at Tulsa's Woody Guthrie Center, more than 50 Oklahoma singers and musicians recorded a song encouraging people to sign up for health insurance under the Affordable Care Act. John Cooper and Brad Piccolo of the Red Dirt Rangers led the session.
Voice be heard. Stand and let your voice be heard.
The majority of the entertainers know what it's like to go without insurance because they're self-employed and have not been able to afford it. The song, Stand, Let Your Voice Be Heard, was written by a pioneer in the red dirt music genre, Chuck Dunlap.
I've never been able to get insurance for myself, and I just played the gamble and paid the bills out of pocket.
He recently returned to the music scene in his home state of Oklahoma, but Dunlap actually signed up for insurance while living in Washington state. He says the process was easy.
Washington accepted the whole plan. They didn't opt out, and that made a big difference for the residents of Washington over Oklahoma, because when your state doesn't opt out, you have a lot more options on ease of information, ease of sign up, options when you do get in.
These musicians are concerned many Oklahomans are shying away from signing up.
I'm glad it is still available here, and Oklahoma cannot deny people the ability to get involved with the Affordable Care Act just because they don't agree with it.
As of March 1st, of the more than 78,000 Oklahomans eligible, only 33,000 had selected a marketplace plan.
I think we're trying to put a friendlier face on it and try to explain to people that it's not a bad thing, that it's a good thing, and it will be good for them and good for their fellow man if we follow through with this plan.
Singer Tom Skinner has had 4 heart attacks, and while he has received veterans health benefits, he couldn't afford insurance for his son.
My son, for instance, I was kind of a single dad. My wife and I divorced in 2000, and he was in the 7th grade, I think. So I raised him myself after that. And that's right, when I was a musician, I didn't have health insurance. I just prayed that nothing happened to him, and luckily it didn't.
His grown son is now paying off huge hospital bills that stacked up after his wife died from heart problems which happened during childbirth. Skinner thinks many politicians just don't understand what it's like to be working poor.
Again, I hate to criticize, but when you look around and you see some situations in this country and people who don't on the surface seem to, for instance, Congress, look at the golden parachute those people have got for what do they do? You could argue not very much.
These are some of the faces of the working poor in Oklahoma. More than 300 people showed up at the Tulsa Morton Health Clinic for what was called Marketplace Monday. Trained navigators guided people through the process of signing up for health insurance on the federal marketplace.
Actually, the healthcare side has run really smoothly today, so we can't complain with that. We've had a few little hiccups, but really quickly remedied. We've been really blessed that we've had a great amount of people here and that are willing to wait the 3 and 4 hours that it's required sometimes.
Tarsha Lawson is a single working mother who can't afford the health plan offered by her employer. Tarsha says the 4 hours she and her father spent at the clinic was well worth the wait.
How much is it going to cost you a month, do you know? So far the plan that I'm looking at is for a family plan with me and my daughter, $58 a month, which is really great. And my dad, I'm not for sure, but I think it's both reasonable and affordable for both of us.
Charlene Holloway also got insurance at the clinic's event. Her paycheck is being garnished each month for her emergency room hospital visits.
This will help out a lot. It'll help me a lot, and I want to worry about so much. I got a little health insurance, and I thank the Lord for that.
The navigators worked with people until late in the evening to get as many signed up as possible, but many insurance seekers found out they weren't eligible.
We assisted 309 people. We actually enrolled 50 in health insurance, and I know that sounds pretty low, but we have had a lot of folks who came here who wanted insurance who are below the poverty level. And if you're below the poverty level in Oklahoma, you don't get assistance in paying for the insurance.
Insurance consultant Teresa Ingram is also telling many would-be clients they aren't eligible.
I'd say the majority of people that I've dealt with are 300% of the federal poverty level and below. And I see a whole lot of people, more people than I wish I saw at the below 100% of the federal poverty level, people that, we say fell into a crater. They get no help from anyone.
The hole was created in 2012 when state leaders rejected money from the federal government to expand Medicaid. Ingram believes that was a mistake.
I see it being a way to keep these people out of the emergency room where they've been going for their primary care. And now those of us that may end up with a broken bone or pneumonia and need to actually get in quickly in an emergency room, those people won't be there anymore. How can that be a bad thing? I don't see that it can be.
Ingram says for those who qualify but may never have had insurance before, there is still a lot of confusion about the federal marketplace.
And I've explained to one gentleman that said to me his doctor told him he wouldn't see him anymore if he signed up for Obamacare insurance. And I said to the man, this is normal insurance. Your doctor will never know where you got this insurance. You will walk in with an insurance card just like everybody else.
Stand up, stay out.
The enrollment period has now been extended by the White House. Anyone who claims to have started the enrollment process on or before the original deadline of March 31st can check a special enrollment box, giving them a grace period to finish signing up.